Welcome to the inaugural episode of Daily Dose with Danny. My name's Danny White with 212 Benefits here in Jacksonville, Florida. We help small to medium-sized businesses implement and manage their health benefits. The purpose of Daily Dose with Danny is going to be to educate consumers on all things health insurance and health care. We'll be covering topics ranging from compliance to plan design, all the way to doing Q&As and case studies with current clients or prospects. Open enrollment season is upon us, so I think it's important that we understand basic terms when it comes to our health insurance. This inaugural episode is going to be a Health Insurance 101 course. How does your health insurance work? Well, there's 5 major terms you need to know, and they all work together to create your plan. The first is premium. A premium is an amount that you owe per month to use your health insurance. Think of it as a subscription. Deductible. What is a deductible? A deductible is a number that you must pay before the insurance carrier steps in to help with payments. What is this help with payments? Well, that is your coinsurance. And coinsurance is a percentage split between you and the insurance carrier for how much of the bill you're going to pay after your deductible is met. The next term is max out of pocket. The max out of pocket is the absolute most that you will pay for healthcare in a given year. And then finally, a copay. Copay is a known, predictable amount for a specific service outlined in your plan design. Typical copays are associated with primary care, specialist visits, urgent care visits, or your prescription drugs. So let's look at an example using all these terms together to figure out how your health insurance plan works. Let's say your plan starts January 1st, 2025. The first service you receive is a primary care visit on January 3rd. Well, looking at the plan, a primary care visit is $30. Now, one thing to note is that copays do not go towards your deductible. They go straight towards your maximum out of pocket. Hence this dotted line down the middle here. So with a primary care visit, you will spend $30. Let's say a couple months go by and you're admitted into the hospital. This is not a copay service, so this is going to be a contracted rate between the insurance carrier and the provider that you saw. For simple numbers, let's say that this hospital visit is a $5,000 bill. Because it's a $5,000 bill, you will be responsible for the first $2,000 towards your deductible. The remaining $3,000, what happens to it? Well, you have coinsurance on your plan, and that coinsurance is 80% to 20%. This means of the remaining $3,000 outstanding on your bill, you will be responsible for 20% of it. And who's on the hook for the rest of it? Well, that's going to be the insurance carrier because of that coinsurance split. They're responsible for the remaining $2,400. So now let's say a couple months go by and you need to go to urgent care. Well, that's going to be a $50 copay. That is going to go straight towards your max out of pocket, though your deductible has already been met. And lastly, let's say to end the year, you did one more visit to a specialist. Again, that's going to be a $60 copay towards your max out of pocket. So let's look at overall what you spent in healthcare this year. So in total, you spent $2,710, and the carrier was responsible for $2,400. So this is a brief overview of how your health insurance works.